just a quick review of the book. Do not give up your favorite sport because of meniscus lesion of the knee. Subtitle, Conservative Treatment of Meniscus Lesions. Quite the title there, covers it. The book's basically divided up into roughly 16 main sections that I could find. So basically I'll name each one just to give you an idea of what's in the book. First one's personal history. Second one's history of medicine. Third is fallacies. Fourth is anatomy. Fifth is types of lesions. Six is physiopathology. 7 is conservative therapy. 8 is fibrocartilage. 9 is ligament part. 10 is importance of diet. 11 is swelling of the knee. 12 one is types of shoes. Then they go into hygiene, 13. 14 is training volume. And 15 is protection measures, I guess, as he puts it. So yeah, book, as you can see, it covers a lot of areas. Overall, it's been rated 4 times. It's getting an average of 3.5 out of 5 stars. The book does have its share of grammatical errors, just to let you know that, but doesn't mean you still can't get the information. I have to say, it is, once you start reading it, it is kind of poorly written, but here again, you can still glean some information. Probably the biggest takeaway is it is written by someone who has suffered from meniscus problems, so there is a lot of value in that, their perspective. On the other hand, so just keep that in mind. This is basically, like one person's experience with it and what they know about it. If you're looking for a more evidence-based book, for instance, and something that's like a set program, like if I do want to do conservative therapy, other books out there, I Tore My Knee, Meniscus, Now What? By Jim Johnson, PT. Basically, the book written by a physical therapist, totally evidence-based, cites all the studies, doesn't ask you to do anything that isn't proven to work. What is a meniscus? Just basically covers, the anatomy and stuff, so you know what it is, what it does, kind of know what you're dealing with. Then it goes into a tear is not a tear is not a tear, basically showing you that there are different types of tears, which may dictate some of your treatment options. For instance, the meniscus is anchored by a root, and so your root tears, can be different than other tears. And some tears will heal on their own, others won't. What to do, the options. This is a really good question and answer section. Like, should we just take the whole thing out? What'll happen? Quotes all the research studies showing long-term follow-up studies of people who have maybe taken the whole thing out. What if you just take part of it out? What'll happen to you? Let's see here. What about trying to repair it? You just try and stitch it and fix it? What if I just leave it alone and do nothing, so here again, it tells you all your options. What about exercise? How does it compare to surgery? That kind of stuff. All the long-term studies where they follow patients even 10, 20 years. If you have a root tear, what do you do? Then it goes into things like a few tips to make things easier. If you need to use a cane, that'll take pressure off it, how to use it properly, how to do stairs, get out of a chair. It goes over icing your knee. This is, if you do want to take the conservative route, which actually, if you look, the book goes through all the studies out there that have been published of exercise versus surgery, the randomized controlled trials, the best of the best, finding that basically surgery, conservative therapy, exercise does just as well as surgery. So you're going to end up at the same place. So to that end, they give you this this really concise exercise program. It tells you exactly what to do, and has beginning, intermediate, and advanced routines wherever you're at. Some people have a meniscus problem and it just bothers them a little bit. Others, they can't hardly walk. So there's a program for everybody. So this is more of a do-it-yourself kind of book. But on the other hand, if you're just looking for a little bit, a lot of general information, one man's experience, I think this is a good resource. So check it out.